Good morning, one and all. Today I am going to take class about outcome of acute inflammation. Right? Today class is about acute inflammation outcome. So before going into the topic, let us see what is inflammation. Inflammation, it is the local response of living mammalian tissue to injuries, and it is the body defense reaction in order to eliminate or limit the spread of injurious agents, and followed by removal of necrosed cells and the tissues, right? So inflammation, it is a local response of living mammalian tissue to injuries, and it is a body defense reaction in order to eliminate or limit the spread of injurious agent, followed by removal of necrosed cells and the tissues, right? This is the uh, definition of acute inflammation. The first century Roman writer named Celsius, he itself has given four cardinal signs of inflammation. They are rubor, rubor means redness, tumor, it is a swelling, calor, it is a heat, dolor, it is pain. So the four cardinal signs of inflammation are rubor, tumor, calor, and dolor. Next slide is what are the types of inflammation. So depend upon the inflammatory duration and the host response, acute inflammation can be classified into acute inflammation and the chronic inflammation. So depend upon the duration and the host response, inflammations are classified into acute and the chronic inflammation, right? And let us see what is acute inflammation. Acute inflammation, it is for the shorter duration and it lasts for less than 2 weeks. It represents early body reactions, and usually this acute inflammations heal quickly, right? So this is the acute inflammation, right? So far we have seen what is inflammation. Inflammation, it is an acute body defense mechanism in order to eliminate the injurious or infectious agent. And the four cardinal signs are, it is rubor, redness, tumor, dolor, calor, right? So these are the four cardinal signs, and based on the duration of the response, it is classified into acute inflammation and the chronic inflammation. Acute inflammation, usually it will be less than 2 weeks durations. Now we are going to the topic proper, outcome of acute inflammation, right? There are various factors which will modify the process of acute inflammation. First is nature and the intensity of injuries. Second, followed by site and the tissue which are affected, and the responsiveness of the host. So these are the various factors which will modify the process of inflammation, right? So the variables that modify process of inflammation are nature and intensity of the injuries, site and the tissue affected, responsiveness of host. And all the acute inflammatory reaction can have one among the following outcomes. Any injuries, either it go for the resolution or suppuration, or it will go for the repair, organization and fibrosis. Finally, it may go for the chronic inflammation also. So these are the outcomes of acute inflammation. So you should remember the outcome of the inflammation are, it can go for the resolution, suppuration, repair, organization, and fibrosis, or it can go for the chronic inflammation. So this picture will clearly tells the outcome of inflammation. As soon as a microbial invasion into our body is an injury, so it will induce the acute inflammatory process. In the acute inflammatory process, we'll be having the vascular and the cellular events, and there will be a dilatation of the vessels and increased permeabilities followed by stasis, pavement of the cells, and immigration of the neutrophils to kill the bacterial invasion. Right? So during this process, you can come across this cardinal signs. There may be local rise in the temperature at the site of inflammation, rubor, tumor, dolor, and loss of functions may be there. These are some of the cardinal signs of the inflammations. And this acute inflammation can have this following outcomes. It can go for the resolution, abscess formation, wound healing, or it can go for the chronic inflammation. So let us see what is in resolution. It is a complete restoration of the tissue to normal after an episode of acute inflammation. That is called as a resolution, right? It is a complete restoration of the tissue to normal after an episode of acute inflammation. That is the resolution. And the condition which favors for the resolution are minimal cell death and damage, injury limited to the or limited for the shorter durations, injury to the organ or the tissue with regenerative capacity, like liver which has a regenerative capacity, but the CNS injuries we don't have a regenerative capacity. So when compared to the liver, CNS does not have regenerative capacity, so it will not go for the resolutions. And the tissue with the good local vascular drainage will lead to the rapid removal of the fluid and the debris. So these are the conditions which favors for the resolution. I am repeating again, the condition which favors for the resolutions are minimal cell death, injury limited to the shorter durations, and injury to the organ or tissue with regenerative capacities, and tissue with good vascular drainage. These are the conditions which favors for the resolution. And what will happen in the resolution is, it is a process where the cellular debris and microbes are removed by the macrophages, right? So cellular debris and the microbes will be removed by the macrophages, and followed by the edema fluid will be resorbed by the lymphatics. So these three phenomena will occur in the resolution. So there is a removal of cellular debris and microbes by the macrophages, followed by resorption of the edema fluid by lymphatics. And so far we have seen the resolution. Now we are moving on to the suppuration. Suppuration, it is a persistent infective agent. If in the body, if there is a persistence of infective agent inside the pyogenic bacteria like Staphylococcus aureus, Streptococcus, Neisseria coliformis, these all are infective agents. These infective agents persistent in our body can lead to the formation of a pus, right? And this collection of the pus is called as an abscess. The composition of the pus is, it is a mixture of living, dying, and dead neutrophils along with bacteria and the cellular debris. So this is the composition of the abscess, right? And coming to the what will happen to the abscess, that is the fate of abscess. This abscess, once it is formed, usually it will points on the surface and end up with the bursting out of the abscess content. Once this abscess content is burst out, the abscess cavity which is there will get collapsed, and followed by there is an obliteration of the cavity and end up with the organization, fibrosis, and finally it leads to the scar formation, right? So this is the fate of the abscess. And if this is happening in the hollow viscous means, for example, in the gallbladder, so the pus will tend to accumulate inside the viscous, and the mucus layers in the outflow of this gallbladders or any tract will be fused together by the fibrin. So there is no outflow of the abscess pus which is formed inside the hollow viscous. So it will tend to collect there and leads to the empyema formations of that particular organ, right? That is the fate of the abscess formations. This picture will clearly tells, you can understand it is the pus pointing out to the surface, right? And in this picture, you can able to see how the abscess is getting evolved, right? In the picture 1, there is a skin which is infected by the bacterial, and it will causes local tissue damage and the necrosis. In the second picture, the bacteria is tend to multiply and it is rimmed by the polymorphs, and you can able to make out the swelling in the second picture. And the third picture, you can able to see the thinning of the epidermis. It is trying, after thinning of the epidermis, it's trying to pointing out the pus in the surface, right? Once pointing out, again in the fourth picture, you can able to see that the pus is coming out of this abscess cavities. In the fifth, there is a the swelling is getting subsided, and the content of the cavity of the abscess is also getting collapsed, organized, and the fibrosed. And in the sixth picture, it will come back to the normal, and it may end up with the small scar formation. This is the fate of the abscess, right? And when we are seeing the abscess, you should remember 2 points. What is sinus tract and what is fistula? Because it is also one of the way of abscess draining out, right? Coming to the sinus tract, it is nothing but it is a abnormal connection between the abscess cavity to the exterior skin. That is, it may be either skin or mucosal surfaces. That is, usually these abnormal connections are lined by the granulation tissue, and this is called as a sinus tract. And coming to the fistula, this is an abnormal passage. This is also abnormal passage only. It can be either 2 mucosal surfaces or 1 mucosal surface and the other as a skin surfaces. A difference between this sinus tract and fistula is sinus tract is usually it's a blunt end, and fistula it will be opened on the both the ends. If you see the picture, you will be better understanding this. First picture is the sinus. It's an exterior. So on one end it is communicated to the skin surface, and other end is blunt. That is the sinus. And the fistula here is both the ends are open. Here it is a mucous membrane to the skin. So this is the fistula, right? So far we have seen what is inflammation we have seen, and what are the cardinal signs, what are the types of inflammations, and what are the outcomes, right? And next we have seen the resolution part, followed by how the abscess is evolved, and now we are moving on to the organization. What is organization? right? This is the process where the connective tissue grows into the area of damage or the exudate. And this connective tissue will be growing into the area of damage or exudate, and this will convert into a mass of fibrous tissue that is called as an organization. Right? You are getting my point? Wherever the damage or exudate is covered, there is a connective tissue will try to grow from inside and convert that exudate damaged part into the fibrous tissue that is called as an organization. And this organization is healed by the fibrosis. Which are the conditions you will be having seen the fibrosis is when there is a substantial tissue loss, some amount of large amount of tissue loss, or when the tissue incapable of regeneration like CNS, and when there is an abundant fibrin exudate which is seen on the tissues or the serous cavities like peritoneum or pleura, or in these conditions, it will heal by the fibrosis, right? For example, just I am telling the process. For example, like the serosal surfaces like meninges, pericardium, pleuras will be covered with the exudate. And if you are not removing the exudate over a long time, and it will stimulate the ingrowth of fibroblasts and the blood vessels, and finally end up with the fibrosis, and you can have the obliteration of the pericardial space. If you see this picture, you can able to see how it is organized and fibrosed. And the first picture, you can able to see there is a parietal pleura and visceral pleura, and the space between that is pleural space is there. Because of the acute inflammation, there is a exudate seen in the potential pleural space. If this exudate is not removed, in the third picture, you can see there is a ingrowth of capillaries into the exudate region and convert that into the fibrosis, and because of the fibrosis, there is an adhesion between the pleural surfaces. So this is also one of the outcome of acute inflammation. First, you have seen the abscess. Now we are seeing this serosal inflammation organization. There is a fibrosis, right? And next thing is we are finally it can go for the chronic inflammations, right? This chronic inflammation, when will we have this chronic inflammation is if this injurious agent is persistent in our body, then it can go for beyond 2 weeks, then it can go for the chronic inflammations, or any interference factors that will inhibit the process of healing will also lead to the progression to the chronic inflammation. So these two processes can lead to the chronic inflammation, right? So far we have seen the outcome of the acute inflammation, resolution, organization and repair, and sometimes it can go for the chronic inflammation. So this is the take-home message. As the process of acute inflammations, the outcome either it can go for the resolution, the complete restoration of the normal tissues, or it can go for the suppuration. It is a local collection of the abscess, and abscess can go for the fistula or sinus tract and discharge of pus. And sometimes there may be extensive necrosis, substantial loss. That kind they can go for the repair, organization, and can go for the fibrosis. If the organisms are still persistent in our body and the healing is inhibited by various factors, then it can go for the chronic inflammation. So this picture, if you are remembering, it was more than enough for the acute outcome of the acute inflammations. This flow chart you should please remember. And when you are writing also answers, you better draw the diagrams. Like in this diagram, you can tell very well, explain what is happening in the acute inflammation. Injuries to the bodies, either it can be bacterial, infection, toxins. Because of this injuries, there is a vascular response and there is a stasis, pavement, immigration of the neutrophils, and once this inflammation is there, then it can go for the resolutions. Resolution is a complete clearance of the infectious stimulus and it comes back to the normal functions. Sometimes it can go for the abscess formation, that's a pus formations. It can go even for the healing by the fibrosis, by the deposition of the collagens. Even if there is a persistence of the infections and any disturbances in the healing process, then it can go for the chronic inflammations. So this is the outcome of acute inflammation. Hope so you understood the acute inflammation. It is a very, very important topic because whenever acute inflammation has occurred, we have to know what are the outcomes, right? Any doubts, please contact. Thank you very much.